As someone who tracks the pharma and healthcare sector, I have watched the followers of LiverDoc's swell steadily on Twitter. LiverDoc, or Dr. Abby Phillips, is a Kerala-based hepatologist and physician scientist who uses the platform to express his strong views against alternative medicines such as Ayurveda and homeopathy. His tweets, often radical, question our age-old beliefs about these medications. This has often sparked strong debates and counter-views. But last week, the platform of argument moved from social media to the real court. And LiverDoc's Twitter account, having 187,000 followers, was suspended on an order of the Bengaluru Civil Court. Himalaya Wellness Corporation, a leading herbal health and personal care company, has in its suit stated that Dr. Phillips made defamatory allegations against the company's products, due to which it has lost substantial business. The company also claimed that the doctor is promoting products of other companies such as Cipla and Alkem. Interestingly, Himalaya's Liv52 has been one of the top-selling drugs in India for treating liver disorder. In a video posted earlier in June, Dr. Phillips had questioned the claims made by Liv52 and stated that the drug's promotion is based on misrepresentation of science and misinterpretation of scientific data. While Himalaya is out there to protect its drug sales, Dr. Phillips, with a suspended Twitter or X account, is quite adamant on his stand against traditional medicines.
We all used to think that herbal means it's on the side, it's natural, it's safe. How can you call this as science? It's not science, that is a pseudoscience. 3,000 crore rupees is allocated in the union budget for Ayush. There is money, there is a lot of money. What we believe in healthcare is traditionally and culturally indoctrinated. There are doctors who misinform. My practice is very closely connected to my social work, my activism. So there is no way that I'll back off from this ever.
But it is not black or white. Even as hashtag BringBackLiverDoc trended on Twitter, the backers of age-old traditional medicine have their arguments taking on the dock. It's Friday, October 6th. From the Economic Times, I'm your host Kiran Somvanshi, and today in a special two-part episode, we bring you the drug debate, allopathy versus alternates, only on the Morning Brief. Hello, Dr. Phillips. Welcome to the Morning Brief. So to begin with, I would like to know how it all started. Like, when did you realize that posting your case studies or patient studies will be something that will be helpful to people?
So the whole aspect of me working on complement and alternative medicines and the liver, it started off in 2016, right after I came back from my super specialization course at New Delhi, Institute of Liver and Biliary Sciences. I wanted to work mostly on alcohol-related liver disease because that is my area of interest. But then as I started practicing, I came across a group of patients who had jaundice and severe hepatitis without any identifiable cause. They were teetotalers, there were children, there were women. We run tests for viral hepatitis, we run tests for autoimmune liver disease. Everything was negative. So ultimately what we did was to go back in retrospect and dive deeper into their clinical histories. And we figured out that there was this temporal correlation in these particular group of patients where they started off with herbal supplements of different varieties. And a few days or a few weeks or a few months later, they started developing this jaundice and hepatitis. So that was like a first for even me at the time, because we all used to think that herbal means it's on the side, it's natural, it's safe. People do take it. It's been going on for a long time, so we don't find any problems with that. But there was this group of patients who were actually struggling because of severe hepatitis. Some of them developed liver failure. Some of them required liver transplantation. Some of them even died without a transplant. So that was a time when I found out that, these alternative medical systems and practices, we had this huge numbers of patients where we, without reasonable doubt, proved that the liver disease was due to herbal supplements or complement and alternative medicines. We published that, including liver biopsies. We retrieved these herbal formulations and other formulations from these patients. We analyzed them. Some of them had very well-known toxic herbs, Some of them had contaminants, some of them were heavily adulterated. So this we published in the Indian Journal of Gastroenterology in 2017, 2018. And in the academic circles, it became such a big deal because this was the first publication which proved that Ayurvedic formulations or homeopathic formulations can actually harm people. Within the academic circles, doctors also started talking about it, and doctors also started asking patients about, if they were consuming any alternative formulations for simple cases of acute hepatitis and jaundice. So this became a norm here. But what was more important was that I was still getting a lot of patients coming in almost every week, up to 5 or 6 new cases I used to see with herbal liver injuries.
So once you realized the problem, how did you go about rectifying it?
So my whole approach to the situation changed because doctors know about it. We treat them, we identify them, but ultimately this was an avoidable disease burden. For example, if we tell people that don't go for untested, unregulated products, so that we can reduce the liver disease burden in such a situation, because prevention is always better than cure. Going all out and doing damage control is not what real medicine is. So once that started, I found out that the value of social media. So initially we used to, through WhatsApp messages and all, we used to send small snippets and informations regarding how herbal medicines are actually harmful. But we need a bigger stage. In 2019, and this was towards the time when the pandemic was also starting, mid of 2019, I joined Twitter, and there I started voicing my concerns about this alternative medical practices and the harms that they're doing for public. I was talking with evidence. It was not like I was just shooting in the dark saying that, this is not good for you, this is bad for you. But I was showing evidence there.
Do you recall any particular tweet that really resonated with the people?
I tweeted about this 14-year-old girl who developed severe alcohol liver disease. And she was a very smart school-going girl. When we did a biopsy on her liver, because we could not figure out what was happening with her, and the biopsy showed that she had severe alcoholic liver injury. And everybody was so stunned. She had a very peculiar kind of cirrhosis, but on top of that, she had alcoholic liver injury also. A lot of features of alcoholic liver injury. And she's a 14-year-old girl. She's not taking any alcohol because it's impossible. So ultimately we figured out that she was taking all these herbal medications prescribed by a registered Ayurvedic practitioner for control of seizures for over 4 to 5 years, and those medications contained large amounts of alcohol. Those herbal medications, and that is why she developed alcoholic liver injury. And that peculiar form of cirrhosis was something known as non-cirrhotic portal hypertension, which is classically seen with arsenic poisoning. And this girl was getting chronically poisoned with arsenic from those herbal formulations that she was taking for her seizures. So there was double insult on her liver. And I tweeted about this, and this became my most viral tweet at the time because people were stunned about, something as innocuous as a herbal drug can actually cause alcoholic liver injury and then chronic arsenic poisoning. And I think that is the moment which broke my internet.
And I've seen many people actually having, polarized views about it. There are people who will say, oh, yes, this is really enlightening. And there are people who will say that, okay, something that we have always done and it's a traditional medicine, home remedy, something that my grandmother has always asked me to. How is it bad suddenly now? So, what is your reaction to all this?
I think a large part of what we believe in healthcare is traditionally and culturally indoctrinated in us. See, I'm a doctor. I've studied medicine all my life. And the way I think is purely from a scientific perspective, from an evidence point of view. But let me just put my legs in a layperson's shoes. And I see that it's not easy for them to understand how the scientific method works. Let's take the example of dengue fever. So it's dengue season everywhere. And then people get infections and their platelet drops, and people are scared and they go for all these home remedies, taking papaya leaf juices, eating papayas and things like that, because that has been taught, that has been indoctrinated generation after generation after generation. They say that, eating or drinking papaya leaf juice will increase your platelets. They don't think twice on it, right? It's just handed down. But then you actually look at what is happening. In dengue fever, every disease has a natural history. So in dengue fever, you'll have fever for like 3 to 4 days. And from the fourth day onwards, your platelets will drop. Your platelets will drop. It's going to drop whatever you do. And by the seventh or eighth day, it is going to climb again. And it will climb again, whatever you do. Right. So what happens is that people will start taking papaya leaves and whatnot during the third and fourth day when the platelets drop. And when the platelets have to rise on the seventh or eighth day, they feel that the papaya leaf juice that they have consumed is actually helping that. But normally it is supposed to rise on the seventh and eighth day. So they have these confirmation biases in them that because I had that papaya leaf juice, my platelets have increased. That is because they don't know the background of how a disease progress or how a disease manifests and how it actually starts and ends. And this happens with the large number of dengue patients because only a very small fraction of them actually develop something known as dengue hemorrhagic fever or dengue shock syndrome, which is very serious and needs ICU care and platelet transfusions and etc. So if somebody actually has dengue shock syndrome or dengue hemorrhagic fever because of very low platelets, papaya leaf will do nothing for them. You have to take platelet infusions, otherwise you are not going to survive. So that is why when we talk about simple things that people have confirmation biases on, because they have already decided that yes, this is how it is, it's not easy for them to break that because their grandmother has told them that, your mother has told them that. So there is a lot of emotion, cultural, traditional values around that thought.
What is your view on alternative medicines as such? Because it has been around even before modern medicine came. So people sought it as a cure in some way or the other. So it has a big, huge history. So what is your view as such for the curability or the efficacy of that science?
So there are two issues we need to discuss here. One is that, because it has been there since 2000 years and because modern medicine or scientific medicine is only 200 years old. So this is the young fellow and that is the older, wiser version of it. This is actually wrong because alternative medicine is still called alternative medicine. That if alternative medicine actually works, it'll be called as medicine only. It will not be alternative. Right. So we don't have alternative physics, we don't have alternative chemistry, we don't have alternative economics and all that. We just have alternative medicine. Now, alternative medicine survives because it's good business. It's nothing to do with patient care. If you look at any of the alternative medicine practices, holistic wellness, or your Ayurvedic wellness clinics or homeopathic clinics, I mean, in any of those practices, it just brings livelihood and business, but it does not actually cater to the healthcare of the people. That's why it is alternative. It is always the second. The reason why it still survives is because people, they love it for the experience of it. For example, somebody has a self-limiting disease and most of the cures that you actually note with alternative medicine is not because of alternative medicine, that's because of the self-limiting nature of the disease per se. So the problem is that people think that something that has happened in the past with them, which is 100% a self-limiting illness, because of some intervention that they have done from alternative medicine, they feel that alternative medicine is going to be useful for many other things in a similar way, which is actually wrong. Now, everything that we know about alternative medicine, you take the whole aspect of Ayush. So that's like ages old wisdom. That was done at a time when light bulb was not invented. It was a pre-scientific era. Homeopathy was written at a time when light bulb was not invented. People did not know about human anatomy and physiology. It's all observations. It's all primal thinking. And based on a lot of hit and trial methods they used to treat at the time. So the whole aspect of curing an illness with an alternative medicine is actually a myth because that illness, which is going to get cured, will get cured even without the alternative medicine.
But like when you say that, there will be people who would come up and say that we have got cured. And of course, you explained that it's because of the self-limiting aspect of the disease. But it's difficult for them to believe that what they got cured of is something because of self-limiting part. And isn't that the same logic with medical science?
No, because somebody says that, I got cured because of this, so this is good. It's actually a personal experience. It's an anecdote. So we don't believe in anecdotes. And if 100 people say the same thing, it's still 100 anecdotes. It's still not evidence. So the plural of anecdotes is misinformation. It's not evidence. So what medical science does is, for example, imagine we have a disease and we have this particular intervention against that disease. So what we do is we put that intervention against that disease in a controlled environment. A controlled environment means that there are no other factors that is going to affect that disease process or the intervention. And then we have another group where the same controlled environment is there, but we don't intervene at all. Now we look at these two groups over a period of few months or few years, and we see how the disease behaves in the controlled behavior with or without the intervention. There are no biases in between. That is why we have the gold standard of randomized double-blind controlled trials to test efficacy and safety of medications in specific diseases. You don't actually see good randomized controlled trials in Ayurveda or homeopathy. And even if you see them in Ayurveda and homeopathy, they will most probably be a negative trial, not a positive trial.
But what if we find a formulation in Ayurveda that is indeed helpful?
Good that we find that it is helpful, but we need to also know why it is helpful and how it can harm in the long term, and how we can actually figure out the right standardization for dosing, duration, and everything in separate specific population like pregnant women or children or elderly. These kind of standardizations we can never do with these traditional medicines because they are too complex for us to simplify them.
So here I would like to kind of make an observation that is it also because of lack of funding and resources that traditional medicine doesn't get its due, and modern medicine, because of the huge pharmaceutical industry which pumps so much of money for research and development, is able to reap those benefits, and traditional medicine suffers on that count?
I'm very happy that you're asking me these questions because these are the strongest myths prevalent in the community, right? So the whole aspect is that there is nothing like alternative medicine industry is poor and modern medicine is richer. Absolutely not. I mean, look at India. 3,000 crore rupees is allocated for in the union budget for Ayush. I mean, this has been happening for last what 9-10 years. There is money. There is a lot of money. And what people call as big pharma is actually not modern medicine pharmaceutical industry. It is actually alternative medicine industry because they are reaping benefits without showing any effectiveness or safety. And they have a lot of money. I mean, look at all the corporates that come behind truth tellers. They have huge money to shut people down. It's not like they don't have funding. They have immense funding. They have huge money in them because if they utilize that money and start testing their products and they see that they fail, they can't sell those things anymore. Classical example is turmeric or curcumin, one of the most well studied, maximum studied, thousands of studies on it since last many decades, and not a single disease condition it is useful for. Just imagine the amount that is being wasted on studying turmeric and curcumin for its whatever benefits they think is in arthritis or inflammatory bowel disease or immunity improvement or whatnot. I mean, it's there. You look at anything in turmeric, there is a study on it. In cancers, in cold, in cough, in everything, but it doesn't work in anything. So that is the reason why they don't want to actually spend money studying, because a lot of these alternative medicine practices will bring out only negative outcomes, and they know it.
Quite radical thinking in the sense it questions the basic beliefs that we all have. Like, moment you talked about turmeric, I was thinking that every day I put turmeric in my food, like in our food that we have, because the sense is that it's anti-infective, antibacterial. So I'm questioning now that should I tomorrow put turmeric or not in the food?
This is something I would like to again clear here. Putting turmeric in the food is the perfect role for turmeric. We want flavor, we want color for our food, and turmeric is made to do that. But don't think of it as a medicine. It's a spice in the kitchen that we can flavor and color our curries with. So turmeric in curries and not in capsules. Because the amount of turmeric that you're eating daily in your diet, or the amount of turmeric that you put in your milk and drink in the morning as haldi doodh, that turmeric is not absorbed in the body. So if you look at the data from the West, and I'm sure it'll soon come up in India and other parts of South Asia also, you can actually see that one of the commonest causes for severe liver injury in the West, one of the upcoming causes is turmeric, because they're using highly absorbable formulations of turmeric supplements. It's not actually giving them any benefit, but it's on the other hand, it is causing them harm.
What about the criticism or allegations which people make against your tweets, and that you represent the big pharma lobby? How do you respond to that?
So I mean, these are just like troll responses, right? I mean, so when you don't have any rational or reasonable criticism to or rebuttal to my statements, what do? You cook up conspiracy theories. So all this big pharma funding agent of the big pharma, these are age-old, decades-old conspiracy theories that the alternative medicine industry or practitioners or sympathizers or apologists of alternative medicine industry bring as a troll response. I just call it as a troll response because I mean it's illogical. So I just shrug it off. Sometimes I fight, but then I've reduced my fighting on Twitter to quite a bit extent now.
But I've also seen the modern medicine practitioners also having reservations about your views. How do you deal with that?
If I look at myself, maybe like 8 or 9 years back, now, I would also maybe argue about a lot of things that people argue with me about now. For example, if you look at a lot of these practitioners, they are not well informed. A lot of doctors are not well read. They are happy with their private practice. It's like a 9 to 5 job. It's like office hours. But a doctor actually works 24/7, maybe not for the patient, but at least in his mind. I make it kind of mandatory that I have to read at least an hour a day about whatever is happening, the new articles, the new journals, whatever. I mean, in my practice in hepatology. So I keep myself updated so that I don't remain dogmatic when it comes to medical practice. And I always want what is best for my patients at the time. So most of the doctors who argue with me, they lack the scientific temperament that I want of them. Because if they did have that scientific temperament and the well-informed knowledge regarding what medical science is and how medical science is progressing, they would never make that argument. Plus, most of these doctors, I remember there was this ophthalmologist who was very worked up with me on Twitter all the time. I mean, I put something, his was the first comment. He was very, very triggered about everything that I put about Ayurveda. So fine, I was wondering what is wrong with this guy. You know, he's an ophthalmologist. I mean, he's trained well in science and he's doing actual ophthalmology practice. And I found out that his father and grandfather were actually Ayurveda practitioners. And they come from a traditional Ayurveda family and they were Ayurvedic ophthalmologists. And now this guy is the scientific ophthalmologist, but he cannot shed that part out. So I think there are a lot of emotional or cultural or traditional baggages that doctors carry, which clouds their mind when it comes to actual scientific discourses. And that is why they fight with me all the time.
But then, do you think it is fair on your part to call it like bluntly pseudoscience, or wouldn't it ruffle with feathers? Like,
No, it is what it is. I did not coin that term. It's an actual definition, which means that the principles and practice are not based on scientific reasoning or rationale. You cannot test it, you cannot validate it, you cannot replicate it. This is pseudoscience. And why? Because if you look at homeopathy, I mean, you take the example of homeopathy, look at the principles of homeopathy. It says like cures like. I mean, for example, something that causes fever in me, I can use the same thing to reduce fever in me. I mean, does it sound logical to you? Like cures like? Impossible. It cannot work that way, right? The second principle is that if you dilute a substance so much that there is nothing left in it, that actually becomes more effective. It's absurd, right? So how can you call this as science? It's not science. That is a pseudoscience. Siddha is a pseudoscience. Naturopathy is a pseudoscience. Homeopathy is a pseudoscience. That is why they are alternative medicine and not real medicine.
yeah, but like, I'm just playing the devil's advocate in the sense that if something doesn't conform to the scientific ways of things, it is not existing or it is not good. How fair is that?
So this is where we have this religious approach to pseudoscience, right? So I'm going to say that there is no God. So somebody is telling me no, there is God. So I'll tell the person, please prove where is he or where is she. He'll say that just because we cannot prove it, that doesn't mean God does not exist. At some point, we will figure it out. That is not reasonable or rational. The right way is to do it scientifically. Because what we can do is we'll have objective evidence, not only subjective evidence. We want objective evidence to whatever we practice or treat our patients with, right? So people will say that my science is not your science. That is what Ayurveda practitioners tell me. I think that's the most hilarious take on pseudoscience ever. My science and your science. There is nothing like that. Science here is the same as science in UK, in the US, in Africa. Medications here are the same everywhere. Diseases all over the world are same everywhere, and we treat all diseases the same way. So when somebody says that it is this way is not the right way, the other way is not the right way, I think that is just a way to distract us from the real context of the conversation.
Coming to the fact that medical science has, in the past, we see that has not always been able to satisfy the patient's needs, so that also possibly turns them to alternative medications, and also accessibility and affordability, so not everybody gets it, and so that's why also people rely on what they can, nature and stuff like that. What do you think about it?
I think these are very two important points. The first is known as God of gaps fallacy. So because medical science has not figured out few things, so there is a gap there, right? That does not mean that gap can be filled by pseudoscience. It doesn't mean that. So just because there is no actual or performable intervention or effective intervention not yet identified, doesn't mean that place should be owned by a pseudoscientific practice. This is the God of gaps fallacy. The ideal thing would be to understand that medical science is evolving. Scientific medicine is not absolutist in the sense that we don't say that, yes, this is the treatment for this disease condition and that's it. No. the treatment will change and it will keep changing. And the better options that we develop in the future, we will embrace that and we will leave the old ones out. So that does not give pseudoscience the license to practice in such populations. So when somebody says that, we don't have actual good doctors in this place, so that is why we go to these quacks, that is not right. Because I think we have to make sure that such things are taken care of from a regulatory level. Those things don't make medical science bad. It just makes the regulatory framework look bad. Accessibility is not medical science's job. That is somebody else's job. Medical science is there and it works. For people to access it, it has to be from the regulatory framework.
I've also seen your tweets, where you have been critical about bodies like WHO or even government of India, where they have looked at integrating traditional medicine with the modern medicine. Wouldn't you welcome such a move where, they are trying to integrate and bring the traditional science at par or some way in collaboration with the modern medicine? No?
A simple answer to that is if we mix apple juice with urine, the urine does not get better, but the apple juice gets worse. So that is basically integrative medicine. So you're mixing something that works with something that does not work, or you have no clue how it works, and giving credit to the whole system. It is just lying. It is deceiving. It's not like integrative medicine is something new. It has been there since very long, and there are a lot of studies on it. And if you look at the high quality studies that look at systematic reviews and meta-analysis of integrative medicine interventions especially in cancer patients, you can see that integrative medicine has never improved the outcomes in specific patient groups better than conventional. But one thing it has done is it has increased the costs. The financial burden has increased because you're integrating something. For example, I have a cough and cold and I go to an integrative OPD and there is an MBBS guy sitting there and there is an Ayurveda guy sitting there. So the MBBS guy will give me a paracetamol, a cetirizine for my cough and a cough syrup. And then the Ayurveda guy will give me, which is okay. I mean, those three medicines are fine for me because it'll take care of my cough, my runny nose and my fever. But then the Ayurveda guy will also give me 2 other herbal medications and 1 kashaya or whatever. So I have 6 medicines now with me for my cough, cold and fever. Now I have spent more money for the same effect. So that is what integrative medicine does to some extent. It just burdens you with more investigations and burdens you with more costs for the same outcome that you can actually get with conventional medicine. So I don't think mixing something that doesn't work with something that works is being truthful to the public health, because it is complete level of deception for public health.
Again, just not medicines. You have also commented on yoga. What about that?
I speak completely from a scientific perspective, which people misinterpret and then come with me. I can't help it, especially yoga. So, I have read the Patanjali Sutras and I know about the newer types of yoga also, the Hatha Yoga, the Vinayasa Yoga, and all those stuff. I've read about it. Now, when I look at the practice, I look at the principles of this practice. So that is what defines the practice, right? The principles. So if you look at yoga, yoga is not just the stretches. There are a lot of components to it. There is mindfulness to it. There is a divine aspect to it. There are lots of things to it. The classical yoga. So in that sense, when you look at yoga, the yoga practice itself is actually pseudoscientific. The classical yoga is pseudoscientific because it's not just stretching and asanas. It's a lot of other things, philosophical and divine and everything, which we cannot explain through science and reasoning. So that is why I say yoga is a pseudoscience. And classical yoga is not an aerobic exercise. So for you to actually burn calories and bring your heart rate up, you have to have aerobic component to it. And that is where yoga actually fails, the classical yoga. So people, when they say that, no, we are doing yoga and our heart rate is going up to 200 and all, what are you saying? That's because they're actually not doing classical yoga. They're actually doing modified forms of yoga, where you do 100 Surya Namaskars in 20 minutes and obviously your heart rate will go up. So, but that is not the way it is written in the actual classical text. And you have these power yogas and all that newer forms of yogas, which are very rigorous. So that makes it aerobic. When I speak about yoga, I speak only about classical yoga. I'm not talking about the other yogas because the Western crowd has actually mutated it in different forms. And that is not the yoga that I know about.
Coming to this whole legal thing, obviously the matter is sub judice, so you may not want to comment on that. But generally, what has been the legal repercussions that we have faced in the past for your views and for your observations?
So, a beautiful article just came out with the title, The LiverDoc's Haters. I think everybody should read that. It's a fantastic article. It actually tells everyone how all the harassments I've gone through since 2016. And it's quite a bit. So I have had from mental harassments to financial harassments to physical harassments and threats and everything. I've gone the whole 9 yards. See, the whole aspect is harassments do come because I am actually questioning dogmas. I am trying to make people think out of the box. And obviously, it's not easy to break that barrier. And also, a lot of what I do impacts practitioners directly or indirectly. But I care about the patients and the general public. So I keep doing it. Ultimately, the kind of harassments that I've faced is one, I have faced legal harassment, legal threats. I have faced my lab partners where we check all these medications for contaminants. My lab partners were actually physically heckled and threatened by a group of homeopaths who came all the way from North Kerala just to do that in a in a vehicle. So I had to shut that lab down, and then I had to move on to a new lab which currently remains anonymous because I don't want any trouble for them also. And the third thing is, litigations like this, where they go for lawsuits and, you basically, they make you lose time and money. Ultimately, it's not that they want to win. They just want to make you suffer the process. The process is the punishment. That is exactly what is happening now. This current lawsuit that I'm defending from Himalaya, it's making me lose a lot of my time with my patients. It's making me lose my sleep. It has made me cancel out a lot of my commitments from a scientific speaking point of view. A lot of my teaching commitments, everything had to be halted because I had to spend continuous 3 nights filing a rebuttal for this. So this is the punishment. This is what they want. Ultimately, they don't care if they win or lose, but they just want to put you through that grinder. And when other doctors see this, they'll just keep quiet. They will not be vocal like me. So that is what they want from it. So I think people should come up more and more so that these kind of lawsuits and harassments and all will at some point will reduce, and then we can actually maintain some level of scientific temperament and integrity within our public healthcare system.
No, it's interesting what you said. Like, I'm just curious to that what will keep you going? Like, will it dissuade you? How you see the future?
I don't think I'll ever get dissuaded because my practice is very closely connected to my social work, my activism. Because every day in my OPD, I see patients struggling with a wrong or patients getting harmed because of misinformation or disinformation, patients getting harmed because of an alternative medical practice, and patients getting delayed treatment and landing up in worse situations where they are financially drained because they were misinformed in a particular healthcare point of view. So when I stop seeing that, maybe I'll stop. Right? Ultimately, people and patients are what centers our world. My world is around them. So there is no way that I'll back off from this ever. And I think more and more people should definitely, doctors should come up and take this over so that we get a better deal for our patients and their families in the future.
But have you had your friends and family telling you that maybe you shouldn't have been so blunt, maybe you shouldn't have posted so much, or maybe you shouldn't have taken on these people?
Yeah, I mean, from different perspectives, yes. I get served the conduct and character certificates almost every day on Twitter, unsolicited. And I get that even off Twitter. And I mean, initially, when I started off with this particular science communication from healthcare point of view, and when I started receiving notices from the Ayush Ministry, I started receiving notices from the Medical Council. Obviously, my parents, my family, they get flustered because they're like, "What is this guy doing? This is like a thankless job, and it's just costing him more." I spend my money over the years checking and analyzing herbal products. I spend my money fighting these guys. I spend money for legal battles, and it's all draining out from me, right? So what am I gaining from it? So there was a point where they had this cognitive dissonance with what I was doing. They were like, I'm on a auto destruct path. But now they realize that it is not so, because I think you burn bright for others to see what is around, and that is exactly what I want to do.
Talking about money, I just remembered one thing. You had mentioned in one of the posts that some research that you are doing on this herbal science, you're going to discontinue it because of lack of funding. Is it so? Or did you get supporters to fund it?
So I think I'll definitely get supporters if I want to continue that. But ultimately, what has happened is since last 5 to 6 years, I've been paying out of from my own pocket and from even my company's pocket, mostly from my own personal space. I've been spending a lot on checking these products that I retrieve from my patients. And as with every good thing, this also had to come to an end because it's not sustainable in the long term. Because I have my EMIs to pay, I have my children's education; they're all in school. and things must move on in that direction also. So that is why we stopped. And at some point, if we do want to revive this movement, I'll definitely look at crowdfunding, because I'm sure people will help. They would like to know.
So here we have a practitioner of modern medicine that believes in the word of science like a gospel and nothing else. He dismisses traditional medicine since it is not backed by scientific methods of trials, tests, and evidence. But this discussion is not complete unless we have a counter view from a voice of authority representing traditional medicine.
This is a cooked up kind of evidence. I am the one who made a rebuttal about that article, and it got published the same journal where he published that hepatology. I don't say even today that everything in Ayurveda is sacrosanct. There can be distortions in any science when it is practiced. Pankpada says very clearly, Yugani Rupa Sandarbho Vibhagena Garitidi. There is a paradigm shift needed if you want to understand Ayurveda. And I am a successful practitioner because people are getting benefit. Even today, the budget of Ayush ministry is lesser than the annual budget of one institution of allopathy, All India Institute of Medical Science. So whatever Himalaya done is a good thing. I congratulate them for that.
That's Dr. G.G. Gangadharan, the founder director of Ramaiah Indic Specialty Ayurveda Hospital in Bengaluru. I speak to Dr. Gangadharan in the second part of this episode, where he takes on most of the observations of Dr. Phillips. You don't want to miss it.